We're here for episode 4 today, and the title of it is How Government Hijacked the Free Healthcare Market. This is a topic I knew I would need to do early on because it's like at the very top of everybody's policy priorities. It's an issue that people across the political aisle, across ages, across demographics care so much about. And it's one that I think, again, it's imperative that we come together on and find ways that we can actually start to find solutions that would actually help people, because it is a hot mess. But it's an episode I was dreading, to be honest, for a couple of reasons. One, I hate healthcare. I don't like the human body. It really grosses me out. I don't even like to watch Grey's Anatomy. So healthcare is not my favorite policy. I don't really like science that much. It's just kind of boring. Also, it's really maddening when you start to dig in. This thing is such a hot mess. It's extremely complicated. I often tell people, I've done a little bit of work around healthcare. I did some work around certificate of need laws and direct primary care. And due to that, I got to work around some healthcare experts. And even the experts, they're experts in their one kind of bucket under the healthcare umbrella. But I don't think there's any single one person in this country that comprehensively understands all of the components of our healthcare system, because it is so massive. It's been so overrun by government for so many years that it's really different to untangle. It's like this giant big ball of red tape and regulation. And in order to really figure out what went wrong, you've got to start to untwist this ball and follow back the red tape to its origins. So it's a lift, and I just have been kind of dreading it. So that all being said, please be aware that today we will not be coming anywhere close to comprehensively covering the problem. It is just not possible to do in a single episode. I think I'll have future episodes on pharmaceuticals, on health insurance. You can dig into each of these kind of things and still have over an hour worth of content. So today's episode, I want us to really focus more specifically on what first went wrong, how the government first got involved. I want us to look at our history, see how healthcare first got so expensive. Why is it tied to your employment? What does the government have to do with that? And I think that will give us a good idea of at least what initially started to cause the problems, so that we have a better framework to work within. And I'm going to go ahead and give you a hint. The problems are not caused by capitalism. This market, they haven't seen capitalism in almost 100 years, maybe more than that. So we're going to dig in, buckle up, because this is a hot mess. First and foremost, I think it's important to understand how far we've come and how quickly. So I want to start in the year 1910. I want you to think about how that's actually not that long ago. There are still people alive from 1910. I know, I checked. In 1910, they had escalators, telephones, washers and dryers, instant coffee, disposable razors. Things were going pretty good in 1910. They also got something else really important, which was the birth of chemotherapy. Paul Ehrlich invented his syphilis treatment, which was called arsenic compound 606. And this was a big turning point. Before this point, medical care in the country was still very primitive. Most people got care in their homes. They were only seen when they were very sick or very injured. They paid cash for these services, and there were town and family doctors, some of them not even full-time. So healthcare was very local. The costs were pretty negligible at this point. Most people were more worried about the cost of missing work for a few days due to illness or an injury than they were about actually paying for the services themselves. Hospitals were mostly somewhere people went to die. They weren't these places where you went to have babies or you went to get care. They were still pioneering things like very common surgeries, such as removing tumors, infected tonsils, appendectomies, I can never say that word, and gynecological operations. You did have the first health insurance company technically come into existence in 1850, but they only offered insurance for injuries incurred in accidents. So it was more a traditional, true sense of insurance, what it actually should properly be used for. And so before 1910, healthcare was really cheap, it was negligible, and mostly, to be honest, people just died from things that we would find very mundane and commonplace today. So cheap, but not a great time in our country for healthcare. People didn't live very long. And there was really no expectation that healthcare could fix that. But when you started having the development of some of these drugs and these first surgeries, things kind of started to change, and people saw opportunities. So while healthcare was rather unadvanced in 1910, it was also this period that regulation and the organization and health professionals began to take hold alongside technological and scientific advancements. The American Medical Association, the AMA, they exploded in membership. They had 8,000 members in 1900. By 1910, they had 70,000 members. And they used this new power to lobby for anti-competitive government regulation in the healthcare field. Of course they did. That's what professional groups always do when they organize. First, they pushed for an increase in medical licensing. I've said it before on the show. I'll probably say it once an episode. Watch the government's hand and professional organizations lobbying the government. Watch them when it comes to occupational licensing. It is this especially awful form of cronyism. It's always done in the name and guise of public safety and health. But in reality, it's always a way that they make services more expensive. They entrench their crony buddies and their special interests, and they often use it to target communities they dislike and block new entrants from a market. I think it's disgusting. Back to the AMA. They also lobbied their way into their state offices overseeing the closure or merger of nearly half of the country's medical schools. And they used this new oversight to reduce the class size in medical schools as well, limiting the number of new doctors introduced into the economy each year. So I want you to remember in episode 2, we covered the laws of supply and demand, and that's applicable here, so I want to do a quick refresher. Remember, these are laws that interact with each other, and when they're in a free market, they determine the real price of goods and services, what people can afford to pay, what people are willing to pay for a product, how much of that product will be supplied. They're really interchangeable, and they can't get away from each other unless you have an outside source, like the government, come in and start messing with the market. When you decrease supply of something, or when government arbitrarily decreases the supply of something, while the demand remains the same, the price for that good or service is naturally going to increase. And that's why they wanted to limit the supply of new doctors coming into the market. They wanted to enrich themselves, and they wanted to create artificially higher new prices. So right then and there, from 1910 on, you don't technically have a free market in the healthcare industry anymore, but it's going to get far, far worse. The AMA actually even has the audacity to brag about this. In a 2008 report they issued, they said, the 1910 Flexner Report on Medical Education recommended stricter entrance requirements, better facilities, higher fees, and tougher standards for medical students. By 1920, the cultural influence of the medical profession was growing as physicians' incomes and prestige increased. Working right as planned. Okay, so let's skip ahead to the next important moments in healthcare history, which are in the 1920s. The cost of healthcare is beginning to rise in the 1920s. It's still nothing like what we see in today's terms. But funny how that happens when you strangle a market and start to limit supply. Oh, wrong page. They start to see advances in technology. Things are continuing to really take off scientifically. And hospitals start to really market themselves as these pristine, clean places to come and get treatment. And they start to kind of develop this concept of intervention, of getting care before you're really sick or injured, as places to have babies. And so it works. People start seeking treatment more frequently. And in the 1920s, hospitals began to offer services on a prepaid basis, largely trying to encourage people to purchase healthcare like they would lipstick at a drugstore, according to one of their leaders at the time. He wanted people to incrementally pay for healthcare so that they got a steady revenue stream. And people had some assurances that if they really needed care, there wouldn't be a massive bill waiting for them. In 1929, a group of Dallas school teachers contracted with Baylor University Hospital for what is widely seen as the first employer-sponsored health insurance plan. They made monthly payments, which would be a premium, of 50 cents per month in exchange for a guaranteed 21 days of inpatient treatment a year should they need it. And that would equal about $7 a month today. These types of plans began to spread, especially during the Great Depression. Hospitals really needed a way to keep their finances up. People weren't seeking health care as frequently. They were worried about their beds going empty, and so they really started to sell these across the country, and this later became known as the Blue Cross Network. So at the end of the 1920s, despite regulation, despite some of these really anti-competitive policies, and despite advancements in services, which is important to note, as we have more types of procedures, more types of healthcare, that will increase costs because you're paying for higher standards. So that's important to note as well. But by the end of 1929, healthcare is still pretty affordable. The average American family had medical expenses of about $103 a year, which was roughly 5% of the average annual income of $1,916 at the time. Enter the 1930s. Dun, dun, dun. The 1930s were rough. We think we have it bad now. I would not be caught dead in the 1930s, I'll say that. In the early 1930s, Pacific Northwest miners and loggers faced rampant illness and hazardous working conditions, meaning they required extensive medical care. To meet this need, their employers organized plans to provide medical services through individual practitioners or groups of physicians for monthly fee. So the Blue Cross network was really applicable to hospitals. This is now moving it to a more broad understanding of healthcare with doctors and those types of services. And this type of plan also began to take off across the country, and it became known as the Blue Shield network. Obviously, later on down the road, these two will merge and become what we now know today as Blue Cross Blue Shield, major insurance player. The creation of these plans was facilitated by state legislation, and those bills allowed them to organize as nonprofit corporations, enjoy tax-exempt status, and avoid the onerous insurance regulations that applied to others in that field. So you see the government is continuing to carve out special interests for their buddies in healthcare and health insurance. I want to point out, this is really important, exempting some companies or sectors from regulations or taxes is another form of crony corporate welfare. It's just as bad as giving them a handout and not other people of a certain amount of tax dollars. It's antithetical to free market capitalism. It's never a good idea. There's a lot of really negatives. I'll do a whole episode on that sometime because that's an issue I just hate. Now, during the 1930s, you have FDR in the White House, and he's the first to really begin pushing for nationalized healthcare. Remember, FDR is in office for 12 years. This is before we had presidential term limits, and he gets a lot of legislation passed. He's very popular. Notably, he gets his New Deal package, which is chock full of anti-capitalist policies that continue to screw us over to this day. But he doesn't get healthcare done in his major packages, not for lack of trying. I want to point out something here. If you are looking at a modern problem in society, and you start trying to figure out where it started or trace it back, 9 times out of 10, it's going to lead you right back to FDR's administration. He was just a giant of bad ideas in this country, and we continue to pay the price for many of those. But he's not totally guilty here, surprisingly enough. He tried, but he failed. But he thought that it was popular. He thought he could get it done, so much so that he actually decided he was going to make nationalized healthcare the total focus of his 1940 campaign for president. But then comes World War II in 1939. And this just sucks all of the air out of the room. All of the attention goes to this. The federal government becomes very afraid during this point that the post-war inflation will wreck the economy. They'd seen what had happened to other countries after World War I, and so they start trying to manipulate the economy to starve that off. FDR's administration implements wage and price controls in the early 40s. Terrible idea. Not free market. Very, very bad idea. This obviously pisses people off. He's capping how much money they can make, and he's telling producers how much money they can earn for their products and for their work. So labor groups are up in arms. Many of them are planning to strike en masse, and that's a really big problem in a wartime economy that needs as many bodies as possible in the factory doing wartime production. So, to pacify workers and employers, the War Labor Board exempts employer-paid health benefits from wage controls and income tax. So employers receive a 100% tax deduction, while the benefits employees receive were exempt from federal, state, and city taxation. This explodes plan participation. You start at about 9% of the population in 1940 that had an employer-based plan, and by 1953, you have 63% of the population. That would keep increasing. By the 1960s, you would have 70% of the population covered by some kind of private, voluntary health insurance plan. So thus, this employer-based insurance model, which started with the Blue Cross network selling coverage to Texas teachers and spread because of government price controls and tax breaks, becomes our system. It really wasn't a thought-out thing. I don't think, people thought, let's tie healthcare and employment. It sort of just happened through a series of really bad ideas and public policy decisions. But there we are. For the next 20 years, from about 1945 to 1965, there's not a ton of movement, but there's a constant push for it from the left. The healthcare market is already pretty overrun with government involvement, telling employers what they need to do, telling insurance companies what they need to do, involving itself in cronyism and tax breaks and all of this. It really can barely even see capitalism in its rearview mirror at this point. But per usual, that's still not enough. People on the left will not stop until they get the fully nationalized system they've wanted all along. In his final State of the Union, which was in 1945, FDR promises to work with Congress to expand government health care. He dies 3 months later. He probably would have gotten it, to be honest, had he lived, because he had wild support and popularity. His successor, Harry Truman, picks up the mantle. he proposes an ambitious new package called the Fair New Deal, which is equally economically bonkers to the original New Deal, and it thankfully fails. But Truman does get something called the Hospital Survey and Construction Act passed, also known as Hill-Burton, and it starts funneling tax dollars to the construction of hospitals. This is a major piece of legislation in American history. By 1975, Hill-Burton had been responsible for construction of nearly 1/3 of U.S. hospitals. That year, Hill-Burton was rolled into bigger legislation known as the Public Health Service Act. By the turn of the century, about 6,800 facilities in 4,000 communities had in some part been financed by the government. These included not only hospitals and clinics, but also rehabilitation centers and long-term care facilities. There's no private market left here. This is totally becoming government run. And then comes in Eisenhower. And by this point, the IRS is looking at this massive growth in the health insurance market in their sector and thinking like, wait a second, why did we let this go tax-free? We want in on this. That's what government always does. So the IRS and the courts actually begin to chip away at the tax-exempt status of many of these health insurance plans. And the Eisenhower administration does not like that. So they moved to push legislation through Congress and lock this system into place. And that was really when it became finalized and entrenched. So now, at this point, you're in the 50s, more and more Americans are finding that their insurance is coming through their employer. Costs begin to rise because you're continuing to inflate demand while supply is either stagnant or restricted in some sectors. And this created a really big problem for people who didn't work, especially people who were not really supposed to be working any longer, like retirees. And those same people were notably those who would need health care services the most, would probably cost the most, and yet they did not have it. And so this was becoming a real issue in society where we were very worried about elderly care and what Western first world society does with its elders, and people wanted to do something. In comes Kennedy. And Kennedy has an elderly father who would not have been covered by insurance at that time, who has a stroke shortly after he's elected. And Kennedy makes this joke and he says, thankfully my father is richer than the president so he can afford health care. And it lands. It strikes a chord with the American people. Kennedy can't get his mind off of it. He just gets obsessed with passing Medicare, which is a government health insurance program that would cover the elderly and people who can't work. So people who have severe disabilities or illnesses. But he dies before he can bring it to fruition. Remember, he's only president 3 years because he is murdered. His successor is Lyndon B Johnson. And it's important to note two things about Lyndon B Johnson. One, Lyndon B Johnson, LBJ, he was dedicated to seeing the remainder of Kennedy's agenda carried out after his death. He really was consumed by this. He kept a lot of the Kennedy administration on staff, begged them to stay. And so this was going to be his mission. He knew how important it was to Kennedy. So it really became his top focus for a time period. It's also important to know, I'm reading a book right now called 1964 that's about the election, and it digs into Johnson quite a bit. And this guy loved government. He had been in government since he was 20 years old. He'd been in D.C. for decades and decades before he became president. This guy had never met a problem that he did not think government could fix. He was my foil. And so he succeeds, and he gets Medicare and Medicaid passed in 1965. Really briefly, to explain the difference between the two, because I even have trouble keeping them straight. I constantly have to Google, which one's which? Medicaid is a program managed by the states, and it's based on income, so it's for poor people. And then Medicare is managed by the federal government, and it's mainly based on age, so it's for when you retire, which traditionally was age 65 or older. At a very basic economic level, these two programs greatly inflate the demand for the services without in any way helping to ensure that the supply increases. But despite that fact, there's a lot of tinkering in the market for decades at this point even. But the market's still kind of limping along. It's getting more expensive, but it's not a total catastrophe yet, which I think is a testament to the free market's ability to overcome a great deal of government intervention. It's hindered, prices are higher than they should be, but we're seeing loads of innovation. You have the first artificial heart, minimally invasive surgeries, organ transplants. It's phenomenal how quickly we're increasing in our scientific and technological advances. In 1970, total healthcare spending was about $75 billion, or $356 per person. So it's manageable. 40 years later, those costs were $2.6 trillion, or $8,402 per person. But it's about to hit. They're about to really start to feel the pinch of their policies. By 1965, healthcare costs were rising at an average of about 8.9%. That's before Medicare and Medicaid. But the new inflated demand, coupled with restrictions on supply, meant that post-Medicaid, Medicare, that rate increases to 11.9% a year. So it's starting to skyrocket up, right? This is really the, turning point in American history. By then, you're in the 1970s. The country was predictably seeing inflation and healthcare prices, and people were again upset. What are we going to do? You still have a good portion of the population that's not covered. And now you've got Nixon in the White House. So things are about to go downhill real quick. This guy was insane. In response to inflation, Nixon implemented wage and price controls on healthcare services because we didn't learn our lesson on that one the first time around. And then he just kind of starts throwing all kinds of government intervention at the healthcare wall to see what will stick. I don't think he knew what to do. In 1972, the Nixon administration starts restricting the supply of hospitals by requiring federal certificate of need for the construction of medical facilities. Guys, certificate of need, also known as con laws, still exist. They still exist federally and they still exist in the states, and they are a massive problem. Basically what they say is that to build a new hospital, or for hospitals to add a bed, or for doctors to add a new piece of equipment like MRI machines or other technology that would help them see more patients, they have to go before a board, a government board, and argue for why they need that service. It can't just be that we want to see more people. They have to argue for why they need it, and then their competitors get to come in and argue against them because they want to keep the prices artificially high, and they know that increasing supply would bring the price down. It's so corrupt. If you want to just really get pissed off, go research con laws for an afternoon. Why do I sound so, nerdy about this? They make me really angry, but I do think it's fascinating that they exist and most people don't know how much they continue to impact our healthcare. Anyways, back to Nixon. In 1973, he authorizes health maintenance organizations to cut costs, HMOs, and this law provides grants and loans to start or expand HMOs, remove state restrictions on federally certified HMOs, and required employers of 25 or more employees to offer this type of plan as a benefit option. In 1974, Nixon passed the Employee Retirement Income Security Act that exempted employee health benefit plans offered by large employers from state regulators and lawsuits. More cronyism. And all of this just utterly fails. It's just terrible policy all the way around. From 1974 to 1982, healthcare prices rose by an average of 14.1% a year. It's just like this nonstop death spiral from this point on, and we're not even to the big kahuna yet, which would be Obamacare. So for time's sake, I'm going to summarize the next 30 years of atrocious public policy decisions in healthcare. And it's important to remember while I do this, that this encompasses Republicans and Democrats in Congress and in the White House. Everybody has blood on their hands for this system. Quit pointing fingers. We're all responsible. Both sides of the aisle contributed to this. You had Reagan, you had Bush, you had Clinton, you had Bush again. All of these guys came in and did terrible things long before Obama ever entered the scene. So to summarize some of the notable things that happened in the 80s and 90s and early 2000s. In 1983, Medicare instituted a prospective payment system for reimbursing hospitals, meaning the government wasn't fully reimbursing providers for their services on their face any longer. In 1986, Congress passed the Emergency Medical Treatment and Labor Act, which forced hospitals to accept anyone who showed up at the emergency room, whether or not they could pay. In 1992, the system for calculating reimbursements to physicians for services covered by Medicare was switched to one based on the cost of resources consumed in delivering a particular clinical service. So again, they're not paying doctors back for what they owe them. At this point, providers begin to deny Medicare and Medicaid patients because they aren't being paid for their services, or they take that amount they're not being paid and they funnel it into their prices as a whole so that the people who do show up with good insurance, who are paying their bills, have to pay those costs instead. All of that makes healthcare more expensive. So Medicaid and Medicare are screwing the average American at this point. And then in the mid-90s, Medicare and Medicaid are getting totally overwhelmed by the increased number of Americans who are dependent on these two systems, and the money is just not working out. The math does not wash. So Congress then tries to control Medicaid costs with the Balanced Budget Act in 1997. Instead, it forced many healthcare providers out of business entirely, which, again, limited the supply, limited competition, prices are going up. In 2003, the Medicare Modernization Act added Medicare Part D to cover prescription drug coverage. It also changed the name of Medicare Part C to Medicare Advantage program. The number of people using those two plans increased to 22 million by 2019. That's more people than are covered under the Affordable Care Act entirely. Those costs rose faster than the cost of Medicare itself. Yikes. It's important to note the nation's reliance on the health insurance model increased administration costs within healthcare. A 2003 study found that the administration itself made up 31% of U.S. healthcare costs, which is twice those found in Canada, and about half of that is due to the complexity of billing. U.S. private doctors' offices use nearly 12% of their revenue on administration alone, and a big reason for that is that there are so many types of payers. In addition to Medicare and Medicaid, you have thousands of different private insurers. Each has its own requirements, forms, procedures. Hospitals and doctors also must chase down people who don't pay their portion of the bill. That's time consuming. That costs a lot of money. They have to hire people to do that. Who do you think ultimately pays for that? We, the consumers, do. This all makes healthcare more expensive. So by the early 2000s, the country is unquestionably in a very hot mess. Democrats are wanting nationalized health care per usual. They want to expand Medicaid, Medicare. They're seeking to add millions of people to a system that is already buckling under its current weight. Doctors and other providers are not being fairly compensated for their work, which is increasingly leading to more and more doctors choosing other fields, because why go into this field, take on all of this schooling, all of this debt, have to pay these high insurance costs yourself to protect yourself, and then not even get reimbursed fully? Like, no thanks. And health insurance costs and the cost of care in general are through the roof, and they're consistently getting higher. In comes Barack Obama in 2008. He promised to do what none of his Democratic predecessors have been able to, which is like the white whale of Democrat policies at this point. He wants to get health care reform, and he's elected to do it. Let's shoot straight here. I'm about to eviscerate Obamacare because it was a terrible idea, and it's had terrible repercussions. There's no question about that. But I commend Barack Obama for wanting to do something, because this system is a national embarrassment. It is absurd. It's ridiculous. Something needs to be done. And I'm so tired of Republicans being the no man. Like, yes, I think the ideas on the left to nationalize healthcare, to give the government more control of this system, is just doubling down on the same things that got us in the mess in the first place and would be a terrible idea. But we need to have alternate solutions. That we can't just do nothing. And that's often what the Republican Party has done. And so they deserve equal blame, I think, for Obamacare, even in the resulting 12, 13 years since it's passed now. They've still come up with nothing else to replace it with. They've barely managed to get rid of it in general. And so it is a frustrating topic of conversation. And I just want to say to people who care so much about healthcare and who want to see a nationalized system, I disagree with you, but I share your passion for fixing it. I think in a rich, wealthy Western country, we should have so much technological advancement. Everybody should be able to afford healthcare. And I think the reasons that we don't have that are because of government intervention. So I'll circle back with some ideas I have that I think would actually would actually create some better access and affordable care in our market. And one problem has been that instead of actually focusing on why the cost of care is so expensive, we consistently focus on getting people covered by the crony health insurance companies. I think the crony health insurance companies should be decimated. I think they should be done away with. I don't think they actually offer health insurance. We should have catastrophic insurance for if things really go wrong and you end up needing significant care. But other than that, we should be able to get back to a system where we can pay real prices for products and services. Those prices and products should be up front. I think in a true free market they would be, and also in a true free market, the companies and the doctors and the providers, they couldn't charge $60,000 for a knee replacement surgery because nobody has $60,000 to pay for a knee replacement surgery. They'd have to bring the actual price back down to meet demand. Law of supply and demand would come back into effect. That's the direction we need to go in. Obamacare went in the opposite direction. It basically padded the pockets of the crony health insurance companies. It screwed over the average American, and it didn't actually make it any cheaper or more accessible. So let's take a deep dive. First, what was actually in the law, because so few people know. One, it legally required all Americans to buy health insurance under penalty of law. Two, the act expanded Medicaid eligibility, created a health insurance marketplace, prevented insurance companies from denying coverage due to pre-existing conditions, and required plans to cover a list of essential health benefits, meaning it removed the option for lower price plans and forced many people to pay for services they did not need to subsidize others. For example, I'm very vocal about not wanting kids, not having kids, no interest. And yet, I now have to pay under any health insurance plan, as do men, for other people to have pregnancy covered, maternity, newborn care, breastfeeding. Listen, I already pay for your kids' education. I already sit on airplanes and suffer through your kids screaming in the background. I have done my part. I should not have to subsidize other people's choices to have kids or not. That's absolutely ridiculous. Anyways, back to what it actually did. It instituted tax credits and cost-sharing reductions on plans for low-income Americans, and it allowed children to stay on their parents' insurance until 26. So, on its face, there's already many problems with the law. One, it's absurd to think the government has the right to tell all Americans they have to buy absolutely anything. What? No, absolutely not. Two, limiting the choice and supply is obviously going to make costs increase and will result in everyone getting a worse product for their money, which it did. And it again increased demand without cutting regulations that would allow supply to similarly grow and keep pace, which is a recipe for disaster, and that is what it has been. Absolute mess. Obama said his plan would cut the cost of a typical family's premiums by up to $2,500 a year. In reality, the opposite occurred. According to the Department of Health and Human Services, premiums have doubled for individual health insurance plans since 2013. That's the year before many of Obamacare's regulations and mandates took effect. The average individual market premiums more than doubled, from $2,784 in 2013 to $5,712 in 2017. That's an increase of 105% in less than a decade. Second, Obamacare supporters claimed it would drastically reduce the uninsured population, but unfortunately this has also not happened. As of this writing, there are roughly 28 million Americans without health insurance. By 2018, the number of Americans covered under the ACA, Obamacare, had dropped from 17.4 million in 2015 to 13.8 million currently. Why is this happening? Because the math doesn't work at all. According to Centers for Medicare and Medicaid Services, simply put, there are too many people without subsidies who cannot afford coverage under Obamacare. Now listen to this example. For example, a 60-year-old couple in Grand Island, Nebraska, making $70,000 a year, which is just slightly too much to qualify for Obamacare's premium subsidy, is faced with paying $38,000, over half of their yearly income, to buy a silver plan that has an $11,100 annual maximum out-of-pocket limit. Like, hard pass? What? No. Onwards. Third, President Obama repeatedly assured voters, if you like your healthcare plan, you'll be able to keep your healthcare plan. But we all know that didn't happen. According to a report by the Heritage Foundation, Obamacare has significantly disrupted the market for those who buy coverage on their own by imposing new coverage and benefit mandates, causing a reported 4.7 million health insurance cancellations of an existing policy in 32 states. People lost their health insurance in droves under Obamacare because the companies could not compete with the government and were forced to close or alter their plans, and it was intended to do that. It was meant to push everybody onto the government system. That was always their intention. Lastly, U.S. households on average saw a 12% increase in their healthcare premiums, or monthly charges they pay for insurance coverage under Obamacare. The average premium increase for a household was $232 annually after Obamacare launched, and people who earn over 400% of the poverty level, which is just $48,000 for a single person, they were hit with a premium increase of almost 23% in a 2-year span. This pummeled the middle class. Like, literally, it's one of the worst things that's ever happened in the middle class in this country. We are not doing well, fam. It's not going well. In 1970, 6.9% of the gross domestic product in the U.S. was spent towards health spending. That was both through public and private funds. By 2019, the amount spent on healthcare has increased to 17.7% of our GDP. That's bad. On a per capita basis, health spending has increased over 31-fold in the last 4 decades, from $353 a person in 1970 to $11,582 per person in 2019. We've got an aging population, we've got an expanding population, and meanwhile, the number of people entering the medical field is not keeping up with the demand. The United States is predicted to see a shortage of up to nearly 122,000 physicians by 2032, as demand for physicians continues to grow faster than supply, according to new data from the Association of American Medical Colleges. If we stay on our current path, it spells disaster. Healthcare costs are going to continue to rise. There's no free market to stop them. There's no reality occurring in this market that would actually force prices to come back down, as they would under a truly capitalist system. It's out of control. And I have to be honest, another reason I was not looking forward to doing this episode is because I feel a little bit hopeless. It's so far down the road. it's so complicated. There's so many laws you would have to repeal to get anywhere close to being back in a free market that it feels impossible, and it feels like the public appetite is just not there for it. And that's very frustrating, because I feel certain that a nationalized system would be detrimental for millions of people in this country. I think we'd get worse healthcare options. These people can't even distribute a freaking COVID vaccine, for crying out loud. Like, the last thing I want is the government in charge of my healthcare. I think that's petrifying. I also think we'd see far less technological advancement, scientific development. I think despite healthcare costs rising, the freer market around research and development has led to great innovation, increase in the length of human life. And so it's disappointing, and I think the situation's pretty dire, but I do want to give a couple ideas that do feel obtainable, at least. My real idea is, like, destroy the health insurance companies, totally obliterate all the laws that entangled government this mess, get rid of employer-based healthcare, get back to a cash-for-services system. And I have to admit, like, I know that's not reality, but there are steps we can take in that direction. So there's a couple I want to raise. The first that I like the most is the one I mentioned I've worked on. It's called direct primary care. And this is taking off in states, typically with general practitioners, which I will mention is the field that's predicted to see the greatest number of shortage. We really need more general practitioners in this country. And a lot of these guys are leaving health insurance entirely. They're exempting themselves from health insurance. And when you do that, you'll find that you also can kind of step outside of many of the regulations of government, because they've been so entangled with the health insurance markets. And what they do is they start offering, like, kind of a gym membership. Like, you would pay $50, $60 a month to have a membership at your direct primary care facility. And with that, you would get usually an unlimited number of visits. You would get like text and video services. You would get like blood testing and certain kind of tests for free under that. And then if you needed additional services, let's say an MRI or a CAT scan, they would negotiate those prices for you on a cash basis as well. So it totally exempts insurance out of the market, screws them over, which I just love. And we've seen that this is a really, it's a workable model. The doctors actually end up making more. They don't have to pay all the administration cost to track down people who can't pay, to process the payments with insurance companies. They get out of a lot of these regulations, so that means that they can spend more time with their patients. They can see more patients per day. Most of them have found that for every 6 patients that pay, they have the opportunity to do 1 charitable case, so it increases charity around the healthcare sector as well. We have to protect that model because, of course, the government and the health insurance companies hate it. It's taking away their profits, and so they've often come in and tried to label the doctors themselves as health insurance providers in the state. In Tennessee, we fought that, and we passed a law that would protect them and allow them to operate as what they actually are, which is doctors and healthcare providers, not health insurance. That needs to happen across the country, and I would love to see that service expanded to things like mental health care and other specializations. I think there's so much potential there. Another thing we need to do, this is again at the state level. It's really good to focus on things we can do at the state level, because it's a lot easier to pass legislation at the state level than it is to pass it federally. We need to allow nurse practitioners to see patients. They have a lot of the same training as a doctor would get. They can do most things that a doctor would, and we should let them basically operate as general practitioners. Some of the licensing needs to be reduced. We need to basically take away some of those restrictions. If you go to see your general practitioner even now, like, usually I see a nurse practitioner at my GP's office. I think I maybe have seen my GP once or twice over like 10 years. I usually see the nurse practitioner. He's far easier to get in with. He's just as knowledgeable. He can do all the basic things I need, like prescribe medications and like generally diagnose me. And then if there's really something that I need to go to an actual GP for, which has never happened, but he could always refer me to an actual GP. That would enable us to increase the supply of doctors and providers. And that's a really easy move that we can and should make. We need to expand and deregulate telehealth. They have been coming after telehealth heavily. They don't like it. It's a freer market. It's a freer form of healthcare. It's especially important for some of the rural areas in this country. We have a lot of things that are known as healthcare deserts, where rural people and poor people often do not have access to healthcare in general. They have to drive really long distances. That's especially dire when it comes to mental health care. Telehealth, Skyping with your doctor is a viable way for us to see more people, decrease the overhead for doctors. That would decrease the cost of healthcare. We've seen during COVID that they've magically lifted a lot of these regulations and licenses that we just had to have for our safety and public health before COVID, and now it's fine. It's operating just fine because it's COVID and it's magical times. No, those things should be exempted permanently. We need to make that a really big, great new market where people have access to that. We need to repeal con laws, like I talked about. These are atrocious, and when you start working against them at your state capitol, your state legislature, you'll see these entrenched organizations of professionals come out to keep them because they want to keep the prices high. So we need organized citizens to show up and get rid of those. We need to make it cheaper to become a doctor. You know, a lot of the requirements around becoming a doctor are unnecessary. They're meant to feed the schools. If you go back to my episode 2 about the reasons higher education has become so expensive, that's especially true in the medical field. There's no reason that doctors should have to work at such, limited pay for so long as fellows. We need to actually try to speed up that process, get them where they can start, even as an apprentice, working under other doctors and see more patients. And we need to get health insurance companies out of the picture. That's one I'll die on that hill. I'd love to see any and everything that demolishes their crony scheme that they've worked out with the government to screw us over, because they are the bad guy in this whole picture, and government as well. But we've got to get rid of that relationship. So that is the basis on how we first got totally screwed over in healthcare. Like I said, there's so much more where this came from. As I was even researching, I kept wanting to go down these rabbit holes because I was like, wait, this is fascinating. And we will do that because I think it's important people understand that capitalism has nothing to do with this market. This is a government crony market, and it has been since well before any of us were alive. And if we want to actually get back to making healthcare affordable, which I do, then we've got to start looking at ways to remove some of this entanglement. So I hope you liked the episode. Leave me a comment. Let me know your questions. Let me know if there's future topics under healthcare you'd really like to see me dive into. Be sure to share my episode. That helps me so much. Comments and likes help, but if you can share it, that really helps to expand the viewership. We're not paying for any kind of views or ads on Facebook or Twitter because of their current stance where people can just be totally removed from their platforms without cause. So we're not giving them any money. All of the growth on the show is organic, which I'm very proud of. We've been doing very well. We've stayed in the top 10% of podcasts each episode. I'm excited to continue, but I do appreciate your help getting the word out, and thank you for your support.